ABFM ITE questions and answers. With complete solutions, 100%. Correct. Question: which antibiotic used for community-acquired pneumonia, CAP, has been associated with ventricular fibrillation, VF? A. Aoedoe azithromycin. This arrhythmia can result from QT interval prolongation, especially in patients with existing heart conditions. Question: which diabetes medications are known to help promote weight loss? A. Heavy GLP-1 receptor agonists, e.g., exenatide. Heavy SGLT-2 inhibitors, e.g., canagliflozin. Question: which screening test is most associated with the risk of overdiagnosis? A. Heavy PSA, prostate specific antigen testing. Question: what is a typical early symptom of amyotrophic lateral sclerosis, ALS? A. OEOE, asymmetrical weakness, often starting in the lower limbs. Question: which opioid should be avoided in palliative patients with severe liver disease? A. Amantadine. It relies heavily on liver metabolism and is best avoided in significant hepatic impairment, though it may be suitable for those with kidney failure. Question: who qualifies for annual low-dose CT screening for Lewin cancer? A. Heavy adults aged 55-80 with a 30-pack years smoking history who currently smoke or quit within the past 15 years. 1/4. Question: which NOAC, non-vitamin K oral anticoagulant, has a specific reversal agent available? Dabigatran. Question: what medication helps reduce alcohol use by making drinking unpleasant due to acute sensitivity? Disulfiram. Antidepressant to be avoided in the elderly. Answers: heavy paroxetine, associated with more anticholinergic effects. SSRIs, SNRIs, atypical antipsychotics, may be added for resistant depression. Age group between which American Academy of Pediatrics recommends administration of an autism-specific screening tool. Answers: heavy 18-24 months old. Most common neurological complication of Paget's disease of the bone. Answers: heavy. Most common cardiac complication of Lyme disease. Answers: heavy heart blocks. Examination finding of those with bacterial vaginosis. Answers: heavy vaginal pH greater than 4.5. Normal vaginal pH should be acidic. Most common cause of medication-related adverse events across healthcare settings in the United States. Answers: heavy antibiotics. 2/4. Screening for asymptomatic carotid artery stenosis. Answers: not recommended. In anaphylaxis, which drug is most likely helpful in preventing the need for intubation? Answers: heavy Barrett's esophagus with no dysplasia. Answers: heavy Positive family Y history of colorectal cancer. Answers: heavy individuals who have a first-degree relative with colorectal cancer or advanced adenoma diagnosed before 60 years of age, or 2 first-degree relatives diagnosed at any age should be advised to start screening colonoscopy at 40 years of age or 10 years younger than the earliest diagnosis in their family, whichever comes first. Most common cause of hearing loss in newborns. Answers: heavy genetic. Inheritance. Lab findings in von Willebrand disease. Answers: heavy U.S. federal labor law requires companies with greater than 50 employees to provide which benefits for employees who are nursing mothers. Answers: heavy Influenza vaccination in those with potential egg allergy. Answers: heavy all. Currently available influenza vaccines, with the exceptions of recombinant and cell culture-based inactivated influenza vaccines, are prepared using embryonated egg culture and can potentially provoke allergic and anaphylactic reactions. 3/4. For those who report that they can eat lightly cooked scrambled eggs, vaccination can proceed without precaution or observation. Those who have experienced only. Hives can also receive any influenza vaccine appropriate for their age and health status. People who have experienced symptoms such as hypotension, wheezing, nausea, or vomiting, or reactions requiring emergency attention or epinephrine after eating eggs or egg-containing foods can also receive any influenza vaccine appropriate for their age and health status and also do not need to be observed. However, the vaccine should be administered by a provider who can recognize and manage severe allergic reactions. How is the timed up and go test useful in GRM patients? Answers heavy check mark helps to assess the risk of falling. Antidepressant that can prolong QT interval to be avoided in those on concomitant. Atypical antipsychotics. Answers heavy check mark citalopram as citalopram. Other SSRIs, as well as bupropion, venlafaxine, and mirtazapine, do not have this effect. Both tricyclic antidepressants and antipsychotics commonly used in PADI and TS, also taking SSRIs, can cause QT prolongation, making their combined use problematic. Antibiotic for travelers' diarrhea. Answers heavy check mark azithromycin. Prevented by washing hands frequently. Most effective medication for treating fibromyalgia. Answers heavy check mark TCAs. SSRIs. Helps with some pain reduction. Powered by TCPDF. www.tcpdf.org. /4